Hi everyone. My name is Katherine Albarico. You can call me Kay for short. Welcome to the presentation on the association between vitamin B deficiencies in women of childbearing age using or have previously used oral contraceptives. I'd like to start by saying that the oral contraceptive pill, or OCP, is one of the most widely used methods by women to effectively prevent pregnancy. About 80% of young women in the United States use hormonal or oral contraceptives during their reproductive years for birth control. With OCPs as one of the most widely used pharmaceutical drugs by women, many studies have shown a correlation to certain nutrient deficiencies in those who take OCPs throughout their reproductive years. Studies have shown that amongst the nutrient deficiencies related to OCP use, vitamin B is the most common deficiency affecting brain and mood function in women. Before we dive deep into the associations of oral contraceptives and B vitamins, I'd like to first discuss the role of B vitamins in our body. Listed here are the 8 B vitamins. These play a synergistic role subdivided into catabolic and anabolic metabolism. This means that B vitamins lead to the generation of energy within the mitochondria, also known as ATP or adenosine triphosphate, as well as the vitamin dependent citric acid cycle that synthesizes compounds like amino acids and fatty acids, respectively. All 8 of these B vitamins collectively and individually play an important enzymatic role in the body. Some examples are energy production, normal cell function and growth, metabolism of protein, carbohydrates, and lipids, metabolism of homocysteine, neurological development, synthesis and regulation of DNA and RNA, synthesis of neurotransmitters, according to Kennedy in his 2016 article. Among the almost 100 enzymatic processes included in its functionality, B vitamins are crucial for brain function. And as we know, the brain, although representing only 2% of the body's actual weight, it accounts for 20% of the body's total energy. As we mentioned in the previous slide, the role of B vitamins in the brain is actually very important. Let's take a highlight on the three: B2, B6, and B12. Palmery et al. In 2013 and Pelton in 2019 effectively explained the mechanisms of action of B vitamins, specifically these three. According to their studies, vitamin B2 plays a vital role in metabolic processing, energy production, normal cell function, growth, and the conversion of coenzymes necessary in certain processes in the body. Vitamin B6, on the other hand, is responsible for almost 100 enzyme reactions. It affects protein metabolism, biosynthesis of neurotransmitters, normal homocysteine levels, immune functions, and hemoglobin formation. While vitamin B12 is responsible for cell metabolism, growth, and replication. It is also important in DNA and fatty acid synthesis, energy production, and carbohydrate and lipid metabolism. We can therefore say that one of the key roles of vitamin B is in neurological health, and it is important in the synthesis of neurotransmitters like serotonin, dopamine, and norepinephrine. We know that these three enzymes, or these three hormones actually, play an important part in our happy disposition, or they are also called as happy hormones. In the same article, Kennedy says the importance of all the B vitamins to brain function is illustrated by the neurological and psychiatric symptoms commonly associated with deficiencies in any of these 8 vitamins. Because we lead our lives and are influenced by many factors, deficiencies in these vitamins are common. So, what are some samples of these deficiencies? Evidence in numerous literature have found that B vitamin deficiencies may be attributed to many factors like inadequate nutrition intake, lack of supplementation, environmental exposures, and lifestyle. I won't go into detail with the deficiencies. If you have the time, go through the charts. 5 of the 8 vitamins, namely B1, B3, B6, B7, and B12, actually all show brain specific symptoms in the form of depression, anxiety, and behavioral change. While these deficiencies may fall under varying degrees of mild, moderate, and severe, it seems evident that these deficiencies in B vitamins may show symptoms of depression and behavioral change. It is very common in these 5 vitamins, therefore, we can say that deficiencies in B vitamins can be symptomatic through depression. How does the B vitamin deficiency and the oral contraceptive pill connect? MacArthur et al. In 2014 found a higher incidence of neurological disorders as seen in vitamin B12 deficiencies. Oral contraceptives containing synthetic estrogen and progestin have effects on carbohydrate and lipid metabolism. These two things, these two metabolisms, are roles that vitamin B12 plays in the neurological function of our body. The study, in the same article, the study specifically notes that vitamin B12 serum levels were 33% lower in users of OCP compared to non-users, further ascertaining potential neurological effects of oral contraceptive use. In another article, Hall et al. In 2015 concluded that large doses of these synthetic estrogens and progestins combined with oral contraceptives could potentially interact with mood-related neurotransmitters and its metabolism. Another study by Gangnell et al. Studied changes in brain activities and mood diagnostic scales and used mood diagnostic scales to observe the effects of OCP use in women. In the same study, it was very interesting to note that the MRI imaging as well as the negative mood scale patterns show an increase in mood deterioration in women using oral contraceptives, and they also showed an even higher result in women who have previously used OCPs. It is all connected. B vitamin deficiency, OCP, and depression. Pelton in 2019 studied that drug-induced nutrient depletions is very evident in oral contraceptive pills. He mentions in his article that astoundingly, and I quote, oral contraceptives deplete more nutrients than any other class of medications. He also includes a survey done between 2011 to 2013 showcasing almost 10 million women in the US using oral contraceptives during their reproductive years, again making it the most widely used medication in women. We go back to our first slide. 80%, what are our numbers? 80% use oral contraceptive pills in the US. The National Center for Health Statistics data brief in 2018 showed that about 10.4% in women were almost twice as likely as men to have depression. In another article published about oral contraceptives, Australian authors Fanasi and McEwen in 2019 reported that from their collection or from their data that they collected, the most common reason for women to discontinue the use of oral contraceptives is depression. We therefore consequently see this possible connection between oral contraceptive use and depression due to the deficiencies in B vitamins. We can therefore summarize that from these reports, from these articles, and from the data collected, it becomes clear that there is indeed a correlation between oral contraceptives and vitamin B deficiencies through or evident through the symptom of depression. The limitations in the research. Majority of the studies exemplified a very small sample size. We can therefore say that this small sample size can lead to a possibly misrepresentation of the true demographics of women taking oral contraceptives. Second, in spite of clear statistical evidence, several of the studies or several of the authors discussed a lack in the true understanding of the mechanisms of action and why vitamin B levels decrease in relation to oral contraceptive use. MacArthur et al. Highlights that some studies have proposed that lower vitamin B12 levels as a false indicator of deficiencies. They cited that several studies have reviewed modern biomarkers of testing B12 levels, and it has shown that there might be a potential redistribution of vitamin B levels rather than an actual depletion in the vitamin. Another limitation is the lack of attention on the true quality and quantity of nutrient intake in women. As we know, nutrient intake plays an important role in vitamin deficiencies and mineral deficiencies. This plays an important part in understanding B vitamin deficiencies that lead to depression. Lastly, further investigations and an improvement in the manner of data collection, sample sizes, and considerations in lifestyle and cycle phases need to be strongly applied when studying the true relationship between OCP use, nutrient deficiencies, and its full effects in women's physical and mental health. I just want to reiterate that cycle phases is a very important exploration that would be beneficial to include in further studies when considering a woman's cycle phase. Some functional medicine practitioners actually have mentioned that the menstrual cycle can be considered as a fifth vital sign. Our hormones, namely estrogen and progesterone, rise and fall during this period, and it has been known to affect mood and changes in mood. Therefore, making it an important factor when considering OCP use and depression. Data collection might prove to be more accurate when we actually consider these phases, as it greatly affects the changes in a woman's mood and emotional disposition. Now we go into the relevance of all this in the nutrition field. In the last 6 years, my experience as a functional medicine certified health coach opened my eyes to the numerous and important issues women face every day. The demands of life, the responsibilities that women take on profoundly affect their physical and mental health. Advocating for women's health means that we ensure that women have options to choose the best contraceptive method that suits her needs, while at the same time providing unbiased information to equip her to make informed decisions. Ultimately, I'd like to empower women to make better choices for their personal choice of birth control. I strongly believe that every woman should have access to resources in order to decide the best and most supportive choice for her body and her own health goals. As a woman and a practitioner myself, I do not wish to instill fear when talking about the potential negative effects of OCP. Instead, I wish to inform and empower women to make the best choice for their body. Furthermore, what are the questions that we need to ask ourselves when we feel like we're in this space? According to Dr. Aviva Rom, a leading functional medicine practitioner, Depression can be defined as a mood or emotional state that presents with feelings of sadness, despair, anxiety, discouragement, and hopelessness. It can be without an unidentifiable cause, trauma, or illness. It can sometimes present with irritability, disturbed sleep, brain fog, and anxiety. If we have clients or patients that may experience this, I invite them to first be gentle with themselves and ask the following questions. Another recommendation that I'd like to talk about is the importance of nutrition. As we know, nutrition plays a very important role in vitamin and mineral deficiencies. While medications may greatly affect the way some macronutrients are metabolized and synthesized, the quality and quantity of the food we eat still takes a huge role when it comes to our nutritional status and mental health. In a meta-analysis by Lee et al. In 2017, the authors concluded that a healthy dietary pattern characterized by high intakes of fruits, vegetables, fish, and whole grains were associated with a reduced risk of depression. As part of my recommendation, a nutrition plan highly focused on low sugar fruits, green leafy vegetables, legumes, whole grains, eggs, good quality fish, and meats would be best. Neuroprotective and anti inflammatory omega 3 compounds like EPA and DHA found in fish and seafood show positive effects for brain health and the reduction of depression. High intakes of fruits and vegetables are also associated with the reduction of oxidative stress and the increase of folic acid levels from these vegetables. This type of diet actually closely resembles a Mediterranean diet. On the right side, you will see food sources of each B vitamin. Another one of my favorite recommendations is this easy and revised food pyramid that I created, and it focuses on nutrient dense, high quality foods. The image depicts a plant focused meal plan with the consideration of high quality grains, vegetables, fish, and other animal proteins. Another important recommendation that I'd like to add for the specific topic is the important lifestyle factors that can help modify mental health and wellness. Studies have shown that these 5 things have been shown to further improve the mental state: exercise, time in nature, sun exposure, meditation and yoga, support groups, supportive relationships, as well as journaling. In my personal experience as a health coach, journaling has been an effective part of mental health. Some reliable sources that I'd like to share for my clients in the future would be books, articles and blogs, podcasts, as well as health coaching platforms. To conclude, as a health coach and an advocate for integrative and functional nutrition, I see the importance of bioindividuality and personalized healthcare. In the recommendations following the obvious statistical significance of B vitamin deficiency following the use of oral contraceptives in women, lifestyle factors like nutrition, exercise, relationships, stress, and the environmental exposures play an incredible part in contributing to potential nutrient deficiencies that can lead to depression. As a woman who understands the experiences that we go through every month, I still strongly believe that the menstrual cycle phases should be highly considered in any research pertaining to a woman's body, hormones, and mental health. Therefore, it is only natural to suggest that all these 5 determinants of health, including the cycle phases, be at the forefront of any healthcare and nutrition plan. Again, this is Catherine. Thank you for listening to my presentation.